you very much indeed. Thank you. And good afternoon and welcome everyone to this meeting of Bracknor Forest Council's Local Outbreak Engagement Board, and which is being live streamed for the benefit of any members of the public who wish to join us. So if we could please, first of all, have a roll call for attendance, and that anybody who has had technical difficulties and so is not present will be marked as having apologised. So over to you, please, Kirstine. Or do you want to do the apologies first?
Thank you, Chair. I've received apologies from Abby Thomas, Mark Brunel Walker and Sophie Gardner. But as you said, sometimes people have problems accessing digital meetings. So anybody who doesn't appear in the call will have their apologies recorded. So if I just run through a roll call, apologies for the road noise in the background. Councillor Dr. Barnard.
Present, but limited connectivity.
Thank you. Councillor Bettison.
Present.
Councillor Birch.
Present.
Councillor Brunel Walker has provided apologies. Andrew Hunter.
Present.
Abby Thomas has provided apologies. Kelly Williams.
Present.
Elena Rozelle.
Present.
Acting Inspector Sophie Gardner has provided apologies. Fiona Slevin Brown. Thank you. I'll record Fiona Slevin Brown's apologies. Philip Bell.
Present.
Thank you. Other attendees with standing invites. Timothy Whedon.
Present.
Thank you. Sarah Bellas. Not present. Councillor Mrs. Hayes. Not present. Councillor Harrison. Not present. Councillor Hayden. Not present. Councillor Turrell. Not present. James Sunderland MP. Not present. Adam Afria MP. Not present. Jerry Barber. Not present. Mary Stamp. Not present. Is there anyone else present whose name I have not called?
I'm present, Kirsty. My name's Gabby Hafner.
Thank you, Gabby. I'll record your presence. Thank you, Chair.
Thank you.
That's a list of all attendees.
Thank you very much, Kirstine. Thank you. Right, and we move on then to agenda item 2, which is to ask members if there are any disclosable pecuniary or affected interests to declare. If anybody has any such interests in any of the items on the agenda this afternoon, if they'd be good enough to declare them now, or failing that, if there are none to declare at this point in time, I just mention the usual caveat that should any discussion take an unexpected turn, please feel free, anyone, to interrupt, to record any interest that becomes apparent during the proceedings. So we move on then to urgent items of business. Kirstine, do we have any urgent items of business that we're notified of?
Chair, no, I'm not aware of any urgent items of business.
Fine, okay. Right, in which case then we'll move to agenda item 4, which is the national and local COVID-19 status. And that's going to be reported to us today by Gabby Hafner. Hello, Gabby, over to you. I think you need to unmute.
One day I'll learn. Thank you. I'm not sure if somebody is helping with the slides.
Are you able to share your screen, Gabby? I don't have
Yes,
copies
of
the
course.
slides. Thank you.
Yes, of course. One moment. Sorry, I'll be with you in a moment. I do apologise. I'm having a little bit of technical difficulty here. I'm not sure, Chair, whether you'd like to move on to the next point and come back to this one. Or
All
would you like
right,
to
yeah,
do it?
that's fine. We'll do that, Gabby, and we all feel for you. So, yeah, we'll give you a bit of a break to see if you can crack it. And in the meantime, we'll move on to agenda item 5, which is the communications and engagement update at national and local level. And that's going to be introduced today by Elena Rozelle. Hi, Elena.
Hi, Chair. Thank you very much. Just bear with me 2 seconds. Hopefully I'll be able to share my screen.
Yep.
Can you see that? Brilliant. Thank you. I'll just try and make it bigger. There we go. So over the past month or so, as you probably would expect, our focus has been to continue to promote vaccinations, specifically around younger people who are now eligible. And we've had quite a few younger people come forward, certainly the 16 to 19 cohort. We've seen lots of people coming forward at Grab a Jab and things like that. So the communications is reaching lots of young people, which is good. We're using lots of case studies and examples of real people because we know that's where it's made a difference before, to encourage that behaviour change and that buy-in, and to really focus on what it means to them, getting back to festivals, getting back to school, getting back to life. So we've been using lots of real case studies. We've been promoting walk-in centres and how to make an appointment as well, alongside CCG colleagues, trying to make the access to vaccinations as easy as possible. We do know that we've still got a little bit of work to do with some of the cohorts, specifically around men under 40, for example, who they're not in the young age group, but they're certainly over sort of 25 to 40, where they're just slower in coming forward. They are coming forward, but they're just a bit slower. So how do we encourage them to actually come forward and get their jabs and protect themselves, protect their families, protect their loved ones, and get back to some sense of normality? So we're just looking at targeting a campaign specifically around gyms, barbers, pubs, builders, merchants, all of those places where we know that demographic of people visit regularly. And that work will be ongoing in the next month or so. We've launched a couple of campaigns over the past month. As you would expect, the return to school, certainly this week and last week. We've been working with our education colleagues to make sure that parents have information directly about testing and keeping up with good health and hygiene practices. And that's been direct messages, but we've also started to do some indirect messaging across our council channels as well. And that will continue over the next couple of weeks. We've launched a Be Courteous campaign. You can see it just on the right-hand side of the screen. It's really embracing that message that while the roadmap has effectively ended, and COVID restrictions have ended, that COVID is still here. So we just need to take as many precautions as we can and be courteous to other people. If they want to wear a face covering, then that's absolutely fine. And respecting other people's wishes around space and encouraging people to get tested when they have symptoms or they've been contact traced. That will be something that stays with us as we continue, certainly throughout the winter months. And then the final campaign that we're just starting to launch and pull together with CCG colleagues is around winter health. So again, as I mentioned, the Be Courteous campaign will be part of that, as well as testing and hygiene measures, but also things like flu jabs to fully protect ourselves as we go into those winter months, when we know that winter bugs and other winter illnesses are most prevalent. We have got an all household booklet that's in production for that. So we get the messages out to the whole borough, but we'll look to expand that across more channels as we progress through the autumn and winter. And then finally, the harder to reach groups. We have a new COVID comms and marketing officer who's joined the team in the past couple of weeks, and she has been tasked with working with our engagement team much more closely to reach those harder to reach groups. She's already had some success with getting messages on a local Gurkha radio station. She's booked some cinema advertising to get to that younger demographic as well. And we've also had some bike advertising in social gathering hotspots across the borough, certainly throughout the summer. And I know this was picked up at one of the local outbreak engagement boards earlier in the summer as to how we were going to get those messages to younger people. We held a focus group, I think it was back in July, where we asked younger people from the Health Champions group that we've got actually what works for them, what channels should we be using, and how should we get those messages to you. And they did give us the idea of using the bike advertising in spots that they hang out with their friends, but also some social media advertising as well, specifically around Instagram and ditching Snapchat, which we had been using, but actually speaking to those people, it's an area where they said we should focus less on in the future. Our engagement team has been in discussion with local community groups to explore options for pop-up testing, and that includes speaking to faith groups and food banks, and the messages that we need to support vaccinations and testing in communities. And certainly we've had lots of proactive discussion, and the food banks are certainly happy to distribute leaflets to residents who are accessing that service, which then gets into another demographic of the population where we haven't had as much direct contact with as we would have liked perhaps over the past couple of months. They're just some of the comms and engagement activities that we've been doing, but happy to take any questions.
Thanks very much indeed, Elena. Thank you. Colleagues, do we have any questions for Elena? No? Okay, I don't see anyone agitating. So thanks very much indeed, Elena. Thank you. That was very good. Gabby, how are you doing? Great. Okay, I'll hand back to you again. Thank you.
Thank you very much. I do apologise. Hopefully this will work this time.
Yep.
So hopefully that's come through. Great. Okay. So it's the usual data and information that you're used to seeing at this outbreak engagement board. So if I'll just move on. So the situational awareness, this is the usual figures that you're used to seeing. So this shows that our current positivity for Bracknor Forest is 8.4, which is higher than the South East average and closer to the England average. Our current rate per 100,000 of the population is 308.5. To put that in perspective, when we last met about a month ago, it was at 237. It's been reasonably static, but just starting to creep up now. And you can see that we are above the Southeast figure and roughly in line with the England figure. Interestingly, Slough are 264. They're currently the lowest in Berkshire, which is quite unusual. And some of our neighbours, particularly towards the west, are experiencing very high numbers, over 350 in Windsor and Maidenhead, and Wokingham and West Berkshire is up to 383. Our figures for the population age 60 plus are currently 121.7. Last time we met, it was only 55, and they are creeping up, as you can see, across the county and the southeast and England. The next slide is the data thresholds, which relate to the previous slide, and I'll just move over to that then more for reference. Looking at this situational awareness across the whole of Berkshire, the blue line is Berkshire, the orange line is the southeast figure, and the grey one, which tends to be higher, is the England figure. And as you can see at the moment, we're Berkshire sitting rather on top of the southeast figure and just slightly below that for England. Looking at each of the 6 local authorities within Berkshire, you can see the picture here. For Bracknor Forest, you can see that we are above the southeast line, but below the England line. And some of our colleagues, such as Reading, have had a bit of a blip where they've been substantially above the England rate. When we look at the county of Berkshire, which is the area in red, and our neighbours, you can see that we're all in this darker blue area, which means our case rate is 250 plus. When we look at the breakdown of cases by age group, currently for Bracknor Forest, we're experiencing 29% is made up from the under 18s, 29% the same figure for 18 to 34s, and 36% for the 35 to 64 group. I've put here the figure that we used last time we had an outbreak engagement board, which shows that they have evened up more. Last time we had a higher percentage in the middle 18 to 34 group. And you can see how the figure fluctuates across our neighbours. But the good news is that the yellow area, which is those who are age 65 and above, remains a small percentage. When we look at our electoral wards, you can see that in the last week that we have full data for, which is the 20th to the 26th of August, Wild Ridings and Central had the highest case rate. And you can see that these figures, which are rounded up to nearest 5, there's just reasonable fluctuations between all of them. If you look on the orange rates, which are the total cases since the beginning of the pandemic, you can see that there are 3 wards with higher rates, and those are exactly the same 3 as they were a month ago. And that's Wild Ridings and Central, Bulbrook and College Town. Looking at the map for Bracknor Forest, you can see that we've got a nice patchwork of colours. The darker the colour, the higher the level of cases. And here I've put what the map looked like a month ago when we met before, and you can see it's largely similar. Here we've got the lowest rate in North Holland, in Great Holland's North Ward, and last time it was in Great Holland's South Ward, but a fairly static picture. Looking at the heat map, and this shows the last 2 weeks across the bottom here and the age groups going up the side in bands of 5. You can see that the darker areas, which is where we have the highest case rates, are in the younger age groups. And for Bracknor Forest currently, that's the sort of 10 to 14 to the 35-year-olds. The little graph up here is that what it was like last time we met. And you can see that since then that the darker colours have spread up through the age group as the cases have become more widespread in the older age groups. Looking at the deaths across Berkshire, last week there was a death in each of Reading, Slough and Wokingham. No deaths in Bracknor Forest last week. Our current deaths are up to 193 for the whole pandemic, and we're currently experiencing lower mortality than we would have expected when we looked at the previous period of 2015 to 2019. Looking at the hospital data, you can see that this is for the Frimley Health Foundation Trust, and that the numbers of people in hospital admitted with COVID, and those in hospital who have COVID are largely static and not increasing at a particularly high rate. And that's a similar picture when we look at the west of the county. And then the last slide really is looking at the vaccination rates. When we look at the second graph here, this is the population that have both doses of the current vaccine. Looking at the 18 plus age group for Bracknor Forest on 73%, and that's increased 2% since last week, but remains 1% below the Southeast average, but above the England average. For the 40 plus age group, we're at 87%, and that matches the Southeast and is 2% above the rate for England as a whole. And then the last 2 slides just remind people where they can find more information. And the last slide is just to update you on some policy updates. So we're continuing PCR testing at Bracknor Leisure Centre, and that's used by people who have symptoms or people who are in a situation where they have been a contact of a close case and are taking a PCR test to see if they are also positive. The self-isolation rules changed on the 16th of August, and it means that if you're fully vaccinated and it's at least 14 days since your last dose, or you're aged less than 18 and a half, you're exempt currently from self-isolation if you're a close contact of a positive case. If you're a positive case, of course, you do still need to self-isolate properly. The travel requirements do keep changing, and we've put the link to the current information there in the policy update section. For vaccinations, we're making good progress now with 16 and 17-year-olds. You probably heard on Friday that the JCVI has currently recommended that 12 to 15-year-olds are not vaccinated, and I believe that the chief medical officers are currently reviewing that guidance. There is mandatory vaccination for care home workers that comes into force in November, and that means that care home workers will need to have had their first dose by the 16th of September to make sure that they can be fully vaccinated in time. And our commissioning team are working very closely with the care homes in our area to make sure that they're given every opportunity to get their staff vaccinated. The flu programme is just about to launch. Information is just coming through in the last day or so, and when we've got a bit more information, of course, we'll share that with you. Working with our schools, my colleague Kelly has issued a pack for the autumn term and held a briefing on Monday with head teachers. We provided a number of good pieces of information, including an outbreak management template to make the schools' job as easy as possible we can in these challenging times. And I think that's the last piece from me.
Thank you very much. Thanks, thanks, Gabby. And I wonder if anybody has any questions for Gabby on her presentation. No, I don't think so. Fine. Well, thank you very much indeed, Gabby. And we move on now to agenda item 6, which is public participation. Do we have any questions from members of the public recorded, Kirsty?
Chair, I'm not aware of any questions that have been submitted to the committee Dropbox in advance of the meeting.
Okay, thank you very much. Thank you. In which case, we'll move on to agenda item 7, which is to review the action log by exception. Do we have anything from the log that requires our attention?
Chair, there's only one open item. The action log has been updated in response to board members' feedback during the last few weeks, and that came out with the agenda pack. The only item that is now open is that all board members are to notify the board of any false or fake news so that it can be addressed and countered with accurate information. That's an ongoing item, so if we don't have any updates, that will remain open until the next meeting.
Right, okay. Right, well, thank you very much indeed. Well, colleagues, if there's no other business, then that draws this meeting to a close. Our next scheduled meeting is to be on the 5th of October. And I'd like to thank you all for your participation today and for your steadfast work in between meetings. And I look forward to seeing you all again soon. Thanks very much indeed.